Haemophilus type B meningitis is an inflammation of the meninges from the word meningitis, which carries the same symptoms such as the bacterial meningitis, such as having stiff neck, fever, and then it is also infects humans through the droplet contact. And then its causative agent is Haemophilus type B influenza or in Haemophilus influenzae type B. It is a facultative anaerobic, meaning it cannot grow unless it is in the host of the body. It is pleomorphic and it is a capnophilic gram-negative Coccobacillus of the family Pasteurelliaceae, and it causes severe illnesses from infections which is more susceptible to children, which is 5 years or younger ages.
Hello, I am Pam, and now we will first discuss the general signs and symptoms of Haemophilus influenzae type B meningitis before correlating them with our patient's clinical presentation. And the general symptoms that may present in early stages of HIV meningitis include unwell feeling, fever, headache, vomiting, and fatigue. And as the disease progresses, more specific symptoms of the typical meningitis symptoms may develop, including stiff neck, sensitivity to light, also known as photophobia, severe headache, seizures or fits, confusion or delirium, sleepiness, and difficulty waking. In babies and young children, symptoms can be different and they may include irritability, poor feeding, blotchy, pale or bluish skin, stiff or floppy body, jerky movements, tense or bulging fontanelle, which is the soft spot on the head of an infant. And other possible symptoms of HIV meningitis in individuals can include decreased in appetite, muscle pain, joint pain, swelling, warmth, discoloration, blisters and drainage, difficulty hearing, frequent mucus producing cough, shortness of breath and chest pain, sweating and rapid breathing, anxiety or agitation, decreased consciousness, and unusual posture. And please take note that HIV meningitis does not typically present with a rash, which is more common in meningococcal meningitis. So now let's correlate these symptoms with our patient's clinical presentation. On day 1, the child presented with fever, irritability, and a sore throat. And these initial symptoms aligned with the general symptoms of HIV infection, such as fever and unwell feeling. By day 3, the child's condition worsened with high fever, vomiting, lethargy, increased irritability, and poor appetite. And these symptoms reflect the progression of the disease, showing more severe signs such as high fever and vomiting. On day 4, the child exhibited classic meningitis symptoms like neck stiffness and photophobia, and these signs are critical indicators of meningitis. In this case, the child's history of recurrent ear infection and incomplete vaccination status, including the absence of HIV vaccine, contributed to the susceptibility to HIV meningitis. Recognizing the signs and symptoms of HIV meningitis is crucial for timely diagnosis and treatment. Understanding the progression from general to severe symptoms can aid in early detection and improve outcomes for affected patients.
Haemophilus influenzae type B meningitis can be fatal if not taken care of immediately. There is still a lot of people who doesn't know about this type of bacterial meningitis, and a lot could be at risk if people are not aware of this. A study conducted by Limcanco et al. 2000 stated that during his study period, there were 118 episodes of HIV meningitis discovered. In addition, he also stated that 95 out of 100,000 children below 5 years old had bacterial meningitis annually. Additionally, the people at risk for HIV meningitis are usually children below the age of 5 years old, elderly that are over 60 years old, and immunocompromised people.
Infections, diseases, and syndromes similar to Haemophilus influenzae type B. First is the Neisseria meningitidis infection. Like Haemophilus influenzae type B, Neisseria meningitidis causes bacterial meningitis. Both organisms can colonize the upper respiratory tract asymptomatically and can lead to a severe disease, especially in young children and immunocompromised individuals. Next is the Streptococcus pneumoniae infection. Streptococcus pneumoniae, similar to Haemophilus influenzae type B, is a leading cause of bacterial pneumonia, sinusitis, and otitis media. Both pathogens can also cause invasive diseases like meningitis and bacteremia, particularly affecting children and older adults. Next is Listeria monocytogenes. Listeria monocytogenes, although less common, it still shares similarities with HIV in causing invasive infection, including meningitis, particularly in immunocompromised individuals and pregnant women. Both bacteria can cross the blood-brain barrier, leading to severe neurological complications. Next is the cryptococcal meningitis. Unlike bacterial causes, cryptococcal meningitis is a fungal. It's caused by Cryptococcus neoformans. However, it mirrors the HIV in its potential to cause meningitis, especially in immunocompromised individuals. They both require antifungal therapy. Lastly is the viral meningitis. Viral meningitis causes viruses. It shares symptoms with bacterial meningitis, including fever and headache. While typically less severe than bacterial forms, viral meningitis can also present with neurological symptoms resembling the HIV, requiring a supportive care and occasionally antiviral treatment depending on the causative virus.
The diagnosis includes the assessment of the patient having the disease. For the clinical impression or seen as undergoing diagnosis, the patient at hand is a 3-year-old female patient that had a series of symptoms in 4 days, including progressive fever, irritability, sore throat, and vomiting. The patient also feels a sense of being lethargic and photophobia, inducing the possibility of meningitis. In this case, a type of meningitis is already observed from the patient. From the signs and symptoms, and apparently the patient has been said to have not yet undergone HIV vaccination due to parental decision. Now that the diagnosis suspected is being caused by the Haemophilus influenza type B, having the disease of Haemophilus influenza type B meningitis. However, several tests, including for bacterial meningitis, were tested to the patient for confirmation of the disease. Now we'll move on to the imaging techniques. Imaging techniques are possible diagnosis tools and procedures to be used in diagnosing the disease, one of which is magnetic resonance imaging or MRI. By using the MRI, a clear image of the body will be presented using a non-invasive method of testing. In this case, having to use MRI will result in seeing abnormalities in the meninges or the brain, and the results of having increased intracranial pressure to the brain. And then the second technique may be used is neuroimaging. In definition, according to Oxford Languages, it is the process of producing images of the structure activity of the brain or other parts of the nervous system. In simpler terms, it is the broader term for techniques like CT scan and MRI. Another imaging technique that could be used to diagnose meningitis is computed tomography scan, or in short, CT scan. CT scan is a diagnostic imaging procedure that uses a combination of X-rays and computer technology to produce image of the inside of the body. It shows detailed images of any part of the body, just like the MRI and neuroimaging. Use of scans may present inflammation to the head and infections associated with the meningitis. In this case, we use cranial CT scans, and these cranial CT scans are used and it rules out the chance of having acute brain edema, hydrocephalus, and diseases of the skull base. And the next are the immunogenic testing, which consists of the lumbar puncture test, which will be tackled in the next parts of the slide, and another one is the blood culture.
To test for Haemophilus influenzae type B meningitis, the doctor would do a spinal tap procedure, or in other words, a lumbar puncture. Doing this procedure will give the doctor a sample of the patient's cerebrospinal fluid, which is essential for the doctor to examine its culture and diagnose Haemophilus influenzae type B meningitis. This has been the gold standard for diagnosis of HIV meningitis.
The risk factors that may arise from the Haemophilus influenzae type B meningitis are unvaccinated from HIV infection, sickle cell disease, HIV infection, antibody and complement deficiency syndromes in ages of 5 years and younger or 65 years and older, but they are much more common in 5 years or younger ages of children.
Moving on to the gold standard diagnosis, specifically the drug of choice or the chemotherapeutics commonly prescribed. The preferred drug of choice used in the treatment of Haemophilus influenzae type B or HIV meningitis is typically ceftriaxone. This is preferred due to its effectiveness in penetrating the blood-brain barrier and their broad spectrum of activity against the pathogen, which is essential for eradicating the bacterial infection from the central nervous system. The treatment of HIV meningitis using this drug is usually initiated through IV or intravenously to ensure good drug concentrations in the cerebrospinal fluid and is continued for 7 to 10 days depending on the patient's clinical response.
So now let's dive to the statistics related to the Haemophilus influenzae type B infections, focusing on the Philippines and the United States. HIV statistics in the Philippines. Specific and current statistics for HIV cases in the Philippines are sparse. So, the most recent data available comes from a cohort study conducted between 1994 and 1996, which reported an incidence of 95 cases per 100,000 children under 5 years of age in Metro Manila. Although this data is outdated, it provides a glimpse into the situation before widespread vaccination. Given global trends and the emphasis on vaccination, it is inferred that the incidence of HIV has significantly decreased in the Philippines due to robust immunizations program. And with that being said, let's just proceed to the country where most cases of HIV meningitis is prevalent. So, in the United States, the introduction of the HIV vaccine has dramatically reduced the prevalence and incidence of HIV infections because in the pre-vaccine era, the combined annual average incidence of invasive HIV disease in children younger than 5 years of age was approximately 88 cases per 100,000 population. And this was similar across the various regions globally, including Asia, Europe, and Latin America.
For the levels of intervention applicable for prodromal intervention, this can be achieved by implementing proper hygiene practices, ensuring adequate sanitation, and prompting vaccination policies. For primary prevention, we can achieve this by immunization against Haemophilus influenzae type B through vaccination. For secondary prevention, we can do this by focusing on early detection and intervention in individuals at risk of HIV infection. This includes timely diagnosis and treatment of children who may be exposed to the bacterium, particularly those vulnerable to developing meningitis. And lastly, the tertiary prevention, we can achieve this by focusing on managing and rehabilitating individuals who have survived the HIV meningitis to prevent a long-term complications.